Hi, this is Dr. Purcell with part two of our exam two video review. My apologies. The recording cuts off at like 15 minutes and it just shut me down and cut me off on part one. So we'll get through this quickly. This shouldn't take long, just a few more minutes here for part two. I want to then look at this question associated with clinical judgment case study one. Even if you had case study two first, then you had case study one. It's just how we named them. So the question is asking, what medications should the nurse prepare to administer this morning? Select all that apply. So um, you were able to look at your orders on the left and you see that metformin, they get that twice daily. So yes, they'll have some of that this morning. Enalapril daily, that would be in the morning. Atorvastatin daily. But what do you know about our statin drugs? What time of day do we give them? They are administered at night in the evening because with our diurnal rhythms, the greatest production of cholesterol is during the day. So we give this at night and we know how long it takes the drug to become active in the body and to start working, and it takes a few hours. So we give it at night so that in the daytime when they're awake and they're eating, for instance, they will get greater control of their cholesterol at the time when the cholesterol would be in higher production. So atorvastatin would not be given in the morning. And your provider is not going to always say, unless it's specified that that drug has to be given at a certain time of day, they're going to expect the RN to know enough about these drugs to determine when to give them. So it is incumbent on you to know that you would give this as atorvastatin at night. The glargine would be given at night, the Lispro before each meal, so that would be this morning. And then acetaminophen, I can't remember if that was on the list. Yes, because the patient complained of a pain of 4 out of 10. So it doesn't mean you're going to give it, but you're going to be prepared to give it because based on what your assessment of the patient is and your knowledge of the drugs. And you know that you had to look at the results here, vital signs at 0700, first thing in the morning. Their blood glucose was 190. You have no other blood glucose level for your sliding scale here, your insulin protocol. So because of that 190, your morning dose of Lispro insulin, Lispro here, is going to be 4 units. So let me come down to the next question that may have been a little bit confusing. This one. Mark on the syringe the amount of insulin the nurse will administer at bedtime. That's going to be your glargine. Your insulin glargine will be given at bedtime. And you do have an order to give Lispro per protocol at bedtime. 2 points here to think about. Number one, you cannot mix glargine and Lispro in the same syringe. You have only one syringe in your picture, in your image there, as to what you're going to get. And that's going to be your glargine at bedtime. Number two, your second point is that you don't have labs here for evening to tell you how much Lispro to give. So in thinking about that, you have to think about that evening dose of insulin and how much are you going to give, and it's going to be the glargine dose. I think that may be the last item really to go through. I'm looking. Yep, that was it. I'm sorry we had to make this into two out of, one out of two, but it did cut me off, and I wanted to get to that last question and make sure you had a chance to review that. Hope y'all enjoyed the reviews, and I wish you much happy studying.